In Africa,
most of the programs, particularly for public health, you find that most of the programs...
So that's right there, it put us at risk. Not only we import more than 90%, but our government are still under the pressure of ensuring access and affordability. So usually the quality is not a priority to many, of our countries. But the reality in the field is alarming. Why? Because we import, and our procurement practices, we will always select companies or bids that they are cheaper, and cheaper means in medicine lower quality. That's one. Two, most of our regulatory authorities in Africa, if it's not all, they still have serious challenges of assuring efficacy, quality, and safety of medicine. So with all this together, add to it that in most of African countries, we don't have strong system on monitoring the quality and efficacy of the and safety of the medicine at the market level, meaning when the medicine is getting close to the patient. Right. So if you take all this together, they are really strong risk factor, which actually should impede or be a barrier to our countries in Africa achieving universal health coverage. And we strongly believe that if we do not ensure the quality of medicine, we will not be able to have strong health system, and thereby we will not be able to achieve universal health coverage. The quality of medicine is very clear to my organization, which has United States Pharmacopeia, right, which has 200 years working on setting standard of quality to ensure quality of medicine at different levels. But in Africa, even though a lot of efforts are being made, and a lot of initiative under the African Union are being made, and soon we were going to even have the African Medicine Agency, which just recently, the treaty of it was approved by the head of state, and we only need 15 countries to ratify it to have, so that we're going to have an African Union agency which is going to help improve the quality, efficacy, and safety of medicine throughout the continent. Right. If you add to this the free trade agreement that it's also signed by almost 49 countries of Africa, that's going to facilitate, trade in terms of medicine. But this together are good initiative, but a lot needs to be done to make sure that the quality of medicine is something that we need to really start looking at, and start looking at now before it's too late. So our message in this conference has been, we will not achieve the objective of ensuring universal health coverage to our population without making sure that the quality of medicine is ensured. Because as you know, with all the system, at the end, the patient needs to take that medicine to be able to cure a burden of a disease.
And Smine, of course, we understand about 100,000 people die every day, and these deaths are directly related to counterfeit drugs. So you're speaking about quality of medicine, but we also understand that counterfeit drugs count about 7% of the global trade. That is about $280 billion every year that is lost to counterfeit drugs. Are we seeing a movement from governments to see that they can actually tackle this, even though we understand most of the countries don't necessarily produce their own medicines?
Yeah. Yes, as I said, there are a lot of initiatives taking place at the continent level, at the regional economic community level, right, and even at country level, to make sure that the quality of medicine is assured. But when you hear about this 7%, 10%, I'm afraid that this is just the tip of the iceberg. Why? Because simply we don't have strong data to really assess the real percentage of fake and substandard medicine. In companies from the East, India, China, and other, they consider Africa as unregulated markets. So meaning that Africa is really the continent where all these fake and substandard medicine are being...
You can simply call it a dumping ground for counterfeit
Exactly.
medicines.
So, and you know, it has been going on for so long, but now this problem is leading, in addition to waste of resources, because you buy medicine at the end, if their quality is not assured, that's a waste of resources. The use of this medicine has other impact. They create, you know, resistance to microbes, antimicrobial resistance, which lead to very high cost. For example, to treat an MDR TB, it's really not as easy as to treat regular TB in terms of cost, in terms of time of treatment, and in terms of burden on the patient and their family. And the same apply to HIV, to antibiotic, to many different, you know, other diseases. And up to now, we are not still looking at the impact of antimicrobial resistance, the rational use of medicine. As I said in the beginning, our governments, because of the burden of disease, they are under the pressure just to get products and make sure they are available. Right. But that needs to change, because if we are not getting products of quality assured medicine, right, we might end by creating more problem than resolving the burden of disease.
To what extent, if you can quantify this for me, to what extent do we see these counterfeits or even the low quality medicines that are coming into Africa going ahead to jeopardize the even national strategies towards effective healthcare? How do you see this being a jeopardy to do that?
You know, in this trade in substandard and counterfeits, medicine is a global problem. Right. However, the countries that are suffering from it are those with low or weak regulatory system.
Can we have a look into some of these countries? Do you perhaps have names?
Yeah, I mean, I have worked I have worked on over 20 countries or plus in Africa, right, and I can tell you that some countries, when we started, the percentage was much higher than 80 to 90% of I would say, medicine of non-assured quality. Right. So when you hear this 7%, which is the global estimation, it's actually depend on country by country. Because in Africa, in most of African countries, we lack the data. Because most of the studies up to date done in most African countries are actually done by donors, either the Global Fund or USAID, PEPFAR or DFID or other. So the government do not have their own, you know, nationally established post-market surveillance program. There are also, issues related to that, because in Africa, in addition to having the burden of the disease and poor quality medicine, it's the only continent where we also, the government or the authority, have also to pay for the cost of market surveillance, while in US or in Europe, it's actually the market authorization holder that pay for this market surveillance. It's meaning that when you get a market authorization to put a product in the market, you are responsible for it until its expiry date, which is not the case in Africa. In Africa, our authority needs to do surveillance and pharmacovigilance and quality sampling and testing and so on. So it's an added burden to already problematic issue about medicine availability, quality, and access in Africa.